here's the Trivial Pursuit exercise to get your juices flowing. I've chosen 10 acronyms and 10 terms that have a particular meaning in the Australian healthcare system and 10 statistics, ditto. So let's just work through them as a group. Just shout out your answer, and Brian up in the back can pick, you can pick the winners, okay? Fastest person. ADHA, what does it stand for? Tutors are allowed? Yep, Australian Digital Health Agency. We have one. AMAC. Australian Health Ministers Advisory Council. It's all the state and territory health ministers plus the Commonwealth or National Health Minister. It's the council that sits down together to figure out how our healthcare system is supposed to work and argue about the money, where the money's coming from to make it work. IHI. Individual Health Identifier. And not to be confused with the tags that were on Brian's wrist in the photo he showed you earlier. Everybody has a 16-digit number in Australia's healthcare system who is entitled to publicly funded services. IHPA. Don't all shout at once. Independent Hospitals Pricing Authority. We have public hospitals and private hospitals in Australia. Private Hospitals Pricing Authority. Nacho, not to be confused with the Mexican snack. National, Aboriginal, community-controlled health organizations. Aboriginal and Torres Strait Islander people have special provisions in our healthcare system, including self-governing community health organizations. NASH, National Authentication System for Health. It's the way that we secure particular pieces of data exchange in our healthcare system. NSQHS. National Safety Employee. Yay, okay. Brian, note that's a chocolate bar. That's right. That is a standard, S&Q, safety and quality, what we all want from our health system, or at least one of the things. That is a standard that health service organizations are meant to meet. PBS. Yes, Pharmaceutical Benefit Scheme. It's a national subsidized scheme for prescription medications. PHN. Good job. Okay, Primary Health Network is a collection of general practices and other community and primary health services in a region to try and work together to get synergies for the people in that region. TGA. Correct. Therapeutic Goods Administration, which is our version of the US FDA, Food and Drug Administration, which determines which devices and drugs are safe for clinical use. Okay. The terms. Who knows what the hashtag #BeSafeFirst means in Australia's healthcare system? What it has to do with? Cosmetic surgery. Don't get your cosmetic surgery done by a charlatan. Make sure that person has some kind of training and knows what they're doing. Bulk billing. Yay. Correct. Yep. So if you go to see a general practitioner, sometimes they will charge you and you will get some kind of rebate from the government if you're entitled to that afterwards. But sometimes some general practices will directly claim the money from the government and you won't have to pay anything for the visit. Closing the gap. Correct. Aboriginal and Torres Strait Islanders in Australia have a shocking health status and health outcome on average compared to the rest of Australia. Shocking. And Closing the Gap is a long-running program to try and close the gap. Extras cover. Extras cover. Yes? If you have private health insurance, not everyone does, not everyone has to, your private health insurance won't cover everything. Sometimes if you pay a little more, it will cover things like physiotherapy, massage therapy, acupuncture, dental care, etc. Fiona Stanley. Okay, multiple meanings here. Fiona Stanley is a very highly decorated Australian woman, very, very active in fundraising through charitable foundations, and has a hospital in Western Australia named after her. It's a hospital which has been a pioneer in trying to become a digital hospital and has experienced some of the glitches in that process. So a couple of aspects of healthcare systems covered off by her, Fiona Stanley. Flying blind. Flying Blind is the name of a series of reports produced by a national coalition of research and industry partners, really pointing out the terribly poor use that we make of data in the Australian healthcare system. Medivac law. What's the Medivac bill in Australia? Yes? Correct. Australia's approach to dealing with refugees and asylum seekers is to put them in offshore detention until their cases are determined. If they have health issues that can't be dealt with in that place, there has been policy very controversially overturned recently that they could be brought to the mainland to receive healthcare treatment. No jab, no pay. This is about childhood immunization. If you don't have your children vaccinated, you may not be eligible to receive certain government benefit payments. And there's also a variant of this called no jab, no play. You may not send your kids to publicly funded childcare centers and preschools. Ross River. Yep, Ross River virus. It's a mosquito-borne disease that originated around the Ross River, which is in northern tropical Australia, but because of climate change has spread as far south as Victoria, so that our public health authorities now advise us in the summer to try to avoid being bitten by mosquitoes. Sid the seagull. Okay. Who's heard of slip, slop, slap? Slip, slop, slap, seek, slide is a very, very successful stay out of the sun or you'll get skin cancer public health campaign in Australia, and Sid the seagull is the long-standing mascot of that campaign. Okay, so once again, I'm just getting your juices flowing. I'm not going to run through the statistics with you.